Good afternoon and welcome to the Heart Collective's Community of Practice session. Where do we start? With our guest, Tracy Thompson, the Director of Behavioral Health for Little Rivers Health, and with Dana Asby, our Education Coordinator at the New England MHTTC. For this session, Dana will start us off and then Tracy will give us a brief presentation about today's topic, followed by a discussion and questions from the audience. I'd like to acknowledge the traditional ancestral unceded territory of the Wabanaki Nation, now known as Wells River, Vermont, where Tracy is joining us from today, and the territory of the Wappinger Nation, now known as the Greater New Haven, Connecticut area, where Dana and I are joining from. My name is Martha Staley, and I will be your webinar manager and host. Next slide. Our funding comes from the Substance Abuse and Mental Health Services Administration. The views and opinions expressed in today's listening session are those of the presenters and moderators, not SAMHSA. Microphones will be muted during the presentation at designated times. For example, during our questions and answer session, you can use the raise your hand feature to request an open mic. When speaking, please be sure to eliminate background noise. You can also submit questions for Dana and Tracy throughout the presentation using the chat. We're pleased to offer the option of closed captioning today for this session. You can select this option and change transcription settings by clicking the CC Live Transcript button at the bottom of your Zoom screen. Registration for this session affirms your consent to receive an evaluation follow-up link via email and your consent to recording this session. If you experience any technical issues, please send a private chat to Ingrid Paget, our technical support manager, for today's session. The MHTTC network uses person-centered, affirming, respectful, and recovery-oriented language in all of our activities. During this session, please ensure that whenever you are contributing to our discussion via the chat or in the Q&A section, that you also use language that is strengths-based, healing, and trauma responsive. We are pleased you joined this Community of Practice session, and now I'd like to introduce Tracy Thompson. Tracy completed her Master's of Social Work degree in 2005 at the University of Central Florida and became a licensed independent clinical social worker in 2009. Tracy has worked with individuals, families, and groups from ages 3 through 89 in a variety of settings. Her experience includes working with individuals who experience symptoms of anxiety, attention deficit hyperactivity disorder, trauma, and other mental health and substance use diagnoses. Tracy, thank you for being with us today. And now I'm going to turn it over to Dana Asby, our education coordinator, to get us started.
Thank you so much, Martha, and thank you, Tracy, for being here. We're excited to hear from you in just a bit. For our first session of this Community of Practice, we're going to start out just giving you a little background about what the Heart Collective is, what our webinar series and Community of Practice attempts to accomplish, and then we'll spend a moment just getting to know who's here with us. Then Tracy will tell us a little bit about her experience developing a collaboration around school-based mental health at Little Rivers Behavioral Health, and then we'll have an open discussion, which will be the majority of our time together. So throughout the first part of the hour, if you can be thinking about anything you would like to contribute to our discussion in terms of successes that you've had around school-based mental health collaborations, any challenges you've experienced, and any questions that you have for your colleagues here on the call and Tracy. So to start out, I wanted to let you know what the Heart Collective is. We are a group of leaders in the New England region in education, behavioral health, healthcare, lived experience, family advocacy. We were convened by SAMHSA and HRSA's Region 1 offices in collaboration with the New England, MHTTC, ATTC, and PTTC. So we had a series of committee-style meetings from November 2020 to January 2021. And during those meetings, we identified some common barriers to school-based mental health collaboration. I won't go through this entire list, but you will get the slideshow if you're interested in learning more about the specific barriers that we identified. But another thing that we decided together as a group was the best way to help folks in the industry overcome those barriers. And having a webinar series and community of practice like we're doing now was one of the ideas. So we're bringing in experts who have successfully navigated these challenges and barriers to tell their stories and inspire you all to implement some of those practices yourselves as you engage in other collaborations around school-based mental health. We do use our compassionate school mental health model in everything that we do in the school mental health initiative in the New England MHTTC. So this does really form a foundation of our work. We really seek to meet youth where they are. We know that they spend a lot of times in their homes and their schools, but that they also engage with adults in the community and various youth serving systems like the justice system and the foster care system and any other system that serves children and families. So we look at trying to reduce trauma and address it at the same time. That's part of our name, the Heart Collective. We are healthcare workers and educators addressing and reducing trauma. And we think about this in 4 different ways: preventing trauma by reducing the causes. And you can see our suggestions for how communities and systems can do this. We also think it's important to support youth who are currently experiencing trauma and mental health challenges, as well as building resiliency to buffer against future instances of trauma, and also to develop protective factors both in the adults that youth encounter and the environments that they find themselves in. And doing all 4 of these things collaboratively, collectively, and at the same time. This is the first session of our community of practice. So we have set up a format where we have a webinar on the first Thursday of each month, where experts come to share evidence-based practices that have really worked for them to overcome those barriers that we mentioned before. And then on the 4th Thursday of each month, we have a community of practice session where we dive a little deeper into that topic and have discussions where we get to learn from each other about what's working, what's not, and bring questions around that topic. So we have linked for you our first webinar, which was with Andrea Amador and Shella Durney from Boston Public Schools and Boston Children's Hospital to talk about various effective collaborations around school-based mental health that they have had. And please join us for upcoming webinars and community of practices. You do need to register for each one, and we'll have a link for that at the end of today's presentation. So just to review very briefly what lessons we talked about during our first webinar, which we do encourage you, if you weren't able to join, to watch the recording of. It was a really great session. These are just some of the foundational skills that we can start to develop to enhance our collaborations. One piece of advice that we had for folks was to really help all staff understand positive listening and conflict resolution skills, to use person-centered language in all of our interactions with students, staff, and collaborators, to leverage the community partners that are already doing some of this work in your cities, states, and regions, to focus on building trust and relationships with potential collaborators before coming with asks. Also developing common commitments, protocols, and expectations once that foundation of a collaboration has been established. And then making sure that we're always being flexible and understanding that changes will occur, and developing feedback protocols so that when there are arguments or misunderstandings, there's a way to respectfully give feedback about how to move forward. They also, Andrea and Shella also talked about the importance of investing leadership in both collaborators, making sure that there's buy-in from the top as well as all the way down to the bottom. Also, the importance about getting creative about funding, and funding will be the topic of next month's webinar and community of practice. Then finally, making sure that we're engaging all stakeholders and authentically. That means making sure that staff, students, and family voice are all heard from the very beginning of these collaborations. So we're excited that you are here with us today, and this will be a largely discussion-based hour. So we'd love to know more about you. We do have a bit of a large group here, so instead of opening up the mics, we're just going to ask you to type in the chat. If you could please let us know your name, what school or organization you are representing today, and where that's located. You can also tell us your role in youth mental health or servicing young people. And then if how you plan to, sorry, that was a mistake there, how you plan to engage in collaboration around school mental health. So now I'd love to pass it over to Tracy to tell us a little bit more about her experience at Little Rivers Health.
Thank you, Dana. Can everybody hear me okay? After 2 years of doing Zoom, you'd think I'd be more used to this. So thank you for inviting me today. As I said, I work for Little Rivers Healthcare. We're an FQHC in Northern Vermont. And our service area kind of falls in a funky place where many services are quite a drive, 30 minutes or more for many of our clients. We, back in 2017, after I had been telling the leadership in the clinics that I needed more time to see students that didn't interfere with school days, we're approached by, at the time, one school, Blue Mountain Union School, which is a pre-K through 12, to find out how we could create more collaboration and make more mental health services available to students. After some discussions and collaboration, around November 2017, in April 2018, I started there 2 days a week, and then my other 3 days were spent in clinic, and I had another clinician that also did 1 day a week at the school. From there, we've expanded into 6 schools. That's all the schools in the OESU or in the supervisory union, except for the career and tech school. So 6 schools, and we now have 7 clinicians. And schools have clinicians ranging from 2 days a week to 5 days a week, depending on size and need and availability of clinicians. One of the benefits that we've seen all across is that increased access and consistency for families. I'm a working parent, and I know the multiple barriers that I have to make a regular child visit or a dentist appointment for my child. And I've got a supportive employment, and I'm well organized. And so for families that are really struggling, whether it's financially or with their own mental health or with any employment or any other obstacles, it's hard to organize around getting your child's mental health services. And so by being right in the school, services are accessible, they are consistent when schools are open. And we've been able to also bridge even summers because many school SEL staff, guidance counselors or others, don't work during the summer or have very limited time during the summer, and we've been able to provide some of that bridging. We've been able to provide crisis services with known clinicians that staff know and who staff are comfortable with immediately. And then for our medical providers, we've been able to bridge some of those questions of what's happening in the school, what's the student's presentation in the school, how's that piece going. Some of the other unexpected benefits have been increased collaboration for larger health events. We did COVID vaccine clinics, not me, medical providers, that it has just increased the collaboration and the communication amongst all of the schools. We have normalized mental health. If you have a sore throat, you go see your primary care doctor to get checked out. If you have depression or anxiety, why wouldn't you go see a mental health person? And so especially high school students and middle school students feel like it's more approachable and feel like it's more accessible. And then sometimes surprised us with their creativity and how they continue their services once they have accessed it. And then from the health clinic perspective, our primary care doctors were identifying these growing mental health needs, and we physically do not have enough space for clinicians. So this allowed us to provide mental health support without using our own clinic space. So some of the things that we really found to be helpful in starting our collaboration, and especially as we expanded to different schools with different leadership, was really discussing, working through and agreeing on shared goals and visions. Why were we doing this? What did they want? How did they want that service provided? Being really flexible and creative on how we make it work. And we find the whole range from school leadership. There's one school that's 7 through 12 that our clinician has learned every student has a study hall and every student has to check their email. And so we can leverage that to see them only during study halls and to communicate and say, hey, don't forget you have your appointment during 6th period today. Another school, the one that I'm in, really just wants the kids seen. They just want kids to have access to it. And so it's come from the administration down that this is important and this is how we're going to do it. And we will support that child missing their class when they need to. We found that being included in school events, meetings, open houses, all of that increases the visibility, increases the collaboration, families, staff, we become part of the community. And of course, having clinicians that want to work with the children, that's key. And a school that really wants to make the mental health work. So I think that's all. That's what I've got.
Thank you so much, Tracy, for sharing your story. And definitely a lot of what you said echoes what was said in the first HEART webinar about that importance of building relationships and finding that common goal and vision. So thank you for elaborating on that. And hopefully we'll have some questions for you. So we're going to open up the floor for a discussion, and we have 3 pretty simple questions that we can jump off on. We always like to start with a strengths-based approach and hear from folks about what some of the successful things that you have done to start a collaboration or to strengthen a collaboration around school-based mental health systems building. And then we'll move into talking about some of the challenges that you've encountered, and finally close with any broad questions you have about building or deepening the relationships that are essential to collaborate on school-based mental health. So we'll just open up the floor. You can raise your hand for an open mic and we will unmute you, or you can also ask questions in the chat. Anyone want to share any successes around collaborations for school-based mental health?
And I've actually updated our mode, Dana, so that people can unmute themselves if they'd like to speak.
Great.
Yeah.
And it doesn't have to be about a full-blown school mental health system, even if it's a new community partnership that you have formed around. Oh, Jamie, go for it.
Hi, I'm just going to say briefly about what we do here. you know, when you have a county of folks who are so different, and when racism is something that's always riding on, it's hard to really to bring about awareness. So what I did was I actually promote culture humility. I'm a BIPOC person by nature, and I actually connect with people from all walks of life because of my role being a peer advocate. I'm able to bring about understanding about not just only cultural competence, because a lot of times in the county we have curriculum that have 4 hours of training with the clinicians or whatever that is actually kind of regulated. But what the staff doesn't understand is like there's more than just competence. We have to make people understand cultural humility is the forward way, because that brings about like a chance to see a glimpse of a person in a whole like lifelong thing. It's not just about, oh, today I understand about cultural competence, finite, there's a full stop. There's no like one size fits all. So I tend to collaborate with my friends who are like, you know, like community, who are made out of family members, and they share their concerns. And in regional meetings, sometimes I get a chance to participate, and because I volunteer with the county, I do interviews and see what's working and what's not, and how do we bridge about that understanding, because of like culture like myself, sub-Saharan culture, we are kind of muted and shunned upon. Speaking up is actually like a shame to the family. So I think there's a lot of kids who are like that too. And for example, just one quick example is that when you talk to me in a school, I will look down, right? For example, I'm the student. But the principal or the person who doesn't understand me will think that I'm actually being rude by not looking at you when you're talking to me. But do you understand that in my culture, when I'm a person who's respectable speaking, our way is to look down because we respect that person. We don't look at them in the eye. So that's a very basic issue, that how do you bring people aware that that's not really being rude or anything, but it's just a way of communicating through silence, you know? So that's one key example. And I put on the chat, I'm willing to help and collaborate with those who are interested. But I've been to your MHTCC meeting before with a lot of you guys over with Dr. Tonika Freeman. And so we did the both conversations, which I completed. So I'm hoping to find mediums to address the common barriers we face on the marginalized community, which is bottom of the totem pole. I'm sorry, that's a mouthful.
That's great. Thank you so much, Jamie, for bringing that up. Yes, definitely, as we go about these collaborations, focusing on increasing cultural humility, which Jamie mentioned is a lifelong journey, not just a single training, not just a single conversation. I did post a link to a piece of information where you can learn a little bit more. Martha also put a link to a learning series that does promote cultural humility in schools specifically. And Ingrid also posted a link to another learning community we have called the Racial Equity and Advancement of Cultural Humility Collective. So we have lots of opportunities to engage in specific conversations on that topic. So I do encourage you, if you want to learn more about that, to join us for some of those conversations. And thank you again, Jamie, for sharing and bringing that topic up. Miriam, did you want to share something?
Sure. I'm going to share a story from a district. So I work at the state level, but we had a district, and I'm sure that many of you face this. So our behavioral health safety net is in Kentucky called community mental health centers, and they're strapped and understaffed, but they're also very often the people who are, most available to go into schools. But a lot of schools have started to move towards hiring their own behavioral health providers. That's a whole different conversation, I think. But anyway, this was a school system that was trying to do a little bit of both. And, their thinking when they first went into this was very much that they needed therapists in the building to do therapy services. And of course, the behavioral health providers wanted to do therapy because that was what was going to be billable. But what they realized after actually 2 years, they came to me and said, we have a huge problem. We're not getting good communication between our behavioral health providers, even the ones who we employ, and our teachers. It's like they're just sitting in the building doing therapy services and never the twain shall meet. And so they really brainstormed and on their own came up with this solution that they were going to, one of their behavioral health providers left and they had this open position. And instead of filling it with a licensed clinical provider, they filled it with a case manager. And that has proved to be a huge boon in ways that I could not have even anticipated. I think I planted the seed for them to do that, but it has reaped benefits that I didn't expect, in the sense that this has been the thing that has helped the school side recognize that the behavioral health providers can and should be doing more universal work. And I've been talking about that for such a long time. So a small and relatively simple and not super expensive thing that yielded all these benefits that I just wanted to share. So a challenge that turned into a success for that district. We're trying to promote that idea in other districts.
That's so great, Miriam. Thank you so much. And yeah, we hear from so many people trying to do these collaborations that, there is not often enough qualified professionals in the area to meet all of those needs. And that does also speak to the idea that it's not just about the treating of what's going on right now, but also universal programming, which is a part of mental health services to help teach those social emotional skills so that we can mitigate some of those mental health challenges before they start to really affect the students. Thank you so much. Does anyone else have any successes to share before we start to transition into challenges? I always hate to call people out, but I do see someone on the call who's doing something innovative around coaching. I'm not sure if Stacy is able to just speak for a moment about what she's doing in her district.
I didn't want to take up time if you wanted to move on, so I'll be very quick. So we have a coaching blueprint that I've been working on for the past year, and part of that is for school-wide efforts around several areas. Positive behavior supports, family engagement, and school-wide mental health is one of those areas. And we have been collaborating with our community mental health center around how we can support students school-wide by implementing break areas or self-regulation areas in every classroom that align with the social emotional learning curriculum strategies that are being taught to the students. And we are also bringing in our community policing partner and his dog to support the implementation of this self-regulation area that we're calling Take a Pause. And so we're trying to tie in a little bit of animal therapy in there for the students. And we're doing a daily mindfulness activity and a literacy library of books for the classroom teachers to access. It's about 80 books for every elementary school around feelings and emotions. And the classroom teachers can use that to complement their SEL lessons. And our guidance or behavioral health counselors can also use some of those books for targeted support. So anyway, we have a few things going on and we're implementing in a pilot school and improving upon that.
Thank you so much for sharing,
Yes.
Stacey. And if you come up with a success later on in the conversation, feel free to come back. We always like to circle back to celebrating those successes. Does anyone have any challenges that you've encountered as you've started these collaborations or tried to sustain them? Often we can get really great collaborations off the ground and barriers crop up while we're in the middle of that. So does anyone have any stories around some lessons learned in this process? Go right ahead, Jamie.
I just want to ask, what do you do when you actually have students who they just simply shut down, like there are times that like even conversation doesn't seem to be a way forward. They just become so like in themselves, like we are like trying to find a way to talk to them. But I'm trying to learn about your culture as much as you guys learn about us, right? How do you break an ice to someone who's just being there but not participating at all, So what do you do in that circumstance?
That is such a great question, and I'm definitely going to ask the rest of the audience to weigh in, but I did want to mention that we actually have an upcoming webinar on that topic, connecting with disengaged youth, exploring educator vulnerability, and not to give away what Sean Perry from We Are Hope will be talking about during that webinar, but he's going to be discussing the importance of being vulnerable as an educator and administrator, and talking about your own struggles and what you have overcome, and also building relationships and the importance of really doing that authentically in a way that decreases shame and helps everybody feel a stronger sense of belonging. So please do join that one to learn more about that topic, but I'm curious what other folks have done when you have those students who shut down and aren't willing to engage. Tanya, did you want to share or ask another question? And if no one has answers for Jamie, that's okay. Sometimes there are things we need to ruminate on. Feel free to also pop something in the chat, like Sierra just did, asking questions and listening. And Miriam said, sometimes sitting quietly, having them draw or read and be respectful and establish a trusting relationship. Those are great answers. Go ahead, Tanya.
Oh, okay. I didn't see what was in the, can you hear me? I'm a little bit under the weather, so I'm not talking very loud. One of the things that we hear that a lot from teachers regarding students shutting down, and we're really working hard and we're getting them to a place of, like it was mentioned in the chat, just letting a student sit still, just letting them be the guide and what it is that they need, that it's okay for them to sit quietly, because sometimes they don't know what they need at that time. And sometimes they need to do some of the techniques that we're encouraging them to use with the breathing to try to regulate and be able to communicate on how they're feeling. It's hard. People are just now starting to see how all the things that we've been talking about and what we've been doing all year are now connected. But yeah, like even as the adults, when we say to them, sometimes you need to just take a step back and sit somewhere and get quiet and get your thoughts together, and then say, sometimes, you know what, that's what the students need too. And it's not a matter of us coming in and seeing students are not working, or their assessments, and there are certain things that are due and you have to meet deadlines. But when you're putting your children's SEL and behavioral needs first, then all the academic stuff gets pushed to the side, and it's expected it should get pushed to the side, because the kids are not going to be able to work at their highest capacity when they're dysregulated. So I think a lot of times the teachers are feeling under the gun and pressured to meet numbers and timelines, that when these things happen, they're looking for a quick fix, as opposed to sometimes that quick fix is actually the gift of time and grace and space for the students to be able to communicate what their needs are.
Beautifully put, Tanya. Thank you so much. We had a few more good answers coming into the chat. Tracy said sometimes sitting quietly is the answer, sometimes having some kind of movement, walking around the field, throwing the basketball. Martha gives us a phrase, move a muscle, change a thought, just changing your scenery, your environment, take a walk. And then Sierra added to let them process however they see best. It's so true. Asking them, often young people, while they may not know the solution to their problem, they can intuit what's going to help them get there. And then Angela is not able to open her mic, but she talked about motivational interviewing, which is really great too. And the MHTTC network has some great resources around motivational interviewing as well. Thank you so much. Wonderful, wonderful contributions. Would anyone else like to share a challenge around collaborating that you have encountered? We can
Sorry.
Oh, go ahead. No, go ahead.
Around collaborating, setting up like school-wide mental health in your school. It's for me, working at the district level, it's hard. I'm not a director, but I've been tasked with setting up the systems. So it's getting really complete district level buy-in to target what we need to do in the schools around some of these practices and to provide the time for me to go in and coach and the targeted professional development. Those pieces need to be in place to set up sustainable implementation and model for the schools. So that's just been a challenge. But as we do the work in a pilot school and we're showing data with positive outcomes for students, I think that will help. But we have to prove it first, or I do. So that's been a challenge, is district support.
Absolutely. Yes. And Sierra also mentioned another challenge when everyone has their own goal. And that's so true. That was a point that Andrea and Shella spoke to, as well as Tracy today. And I remember in our conflict resolution webinar that we did, one of the presenters talked about the importance of remembering that we're all working towards helping young people have the highest level of well-being that they can achieve. And really, that's what we're all working towards. And if we just remember that and try to come back to that, there's a way that we can, find those little tweaks to our steps along the way towards that goal, but just keeping that in mind can be really, really powerful. Great. Music also, Martha mentioned, the great way to help children express themselves. Wonderful. All right, we have about 20 minutes left. Does anyone else have a challenge that they'd like to share, or any feedback for Stacy around that leadership piece, having that buy-in at the district level? Has anyone had success around convincing district level leaders to buy into these collaborations?
Can I ask a question about this?
Yeah.
I'm wondering if people think that there's any more inclination towards buying in because of the pandemic and this kind of general recognition of the impact of the last few years on youth mental health and well-being, on everybody's mental health and well-being, but particularly with the Surgeon General's report that just came out and those kinds of things. Do you all sense that it's an easier sell or persuasion, or hasn't really shifted much?
That's a great question. We've been speaking to state level leaders, and there's definitely a higher sense of urgency It's definitely recognize that this is something that we need to do right now. But there are just so many complicated factors that make it difficult to get all of the districts in a state bought in, or if you're in a school district, getting all of the schools in the district bought in. But I would say there's more interest because of the mental health needs that have arisen because of the pandemic. What do folks see in their local communities?
This is Tracy, I can speak. I don't know how to raise my hand. What I've heard from the principals that we've been working with is that even if they were supportive before, there's been an increased level of awareness and gratefulness, I think is maybe the right word, that we've had that relationship already built. I know we were in the pandemic when we started a couple of the schools, and there was a concern, well, you know, what do I need to do with my mental health clinician? Like, are they just going to be sitting there? And once we had the clinicians in the school and up and running, the feedback was, oh my goodness, thank goodness they're there. And that was a similar response as schools closed down, and we were able to help, especially guidance counselors, bridge some of the families that we were, you know, everyone's frantically trying to get a hold of and find and make sure everything's okay. We were able to say, here's the list of families that we've been able to connect with, and to assist with that. So I think there's certainly more need identified and more awareness of supports that are already either in place or need to be in place.
So the reason I asked the question, and I don't want to take up time if there's another activity, I can't remember the agenda. Okay. The reason I asked the question is because what I'm finding is I'm hearing when I'm with administrators or counselors or school psychs and all of those folks, even teachers, yes, teachers also, I'm hearing everybody say, yes, 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 this is really important. And then like when we got back into classrooms or you know, just as this year has unfolded, what I'm hearing from teachers is that there still is this incredible pressure about outcomes and academic outcomes, and that even though admin has said, yes, this is important, it really has not translated into changes in the way the school practices are happening the day to day. And so I'm wondering if you guys are seeing anything, or if you have any tips. I mean, I think that as I hear you, Tracy, you know, one of the things we always try to do is get somebody who's had a positive experience talk to their peers.
There is my outside looking in perspective, you know, being in the school but not always being in the classroom, is there is still that pressure for testing. There was a lot of conversation around, you know, it was 2 years ago that students had a normal school year, and so there's a huge behavior gap that's being seen. The PE teacher mentioned the other day that all of the middle school classes that he's running, he has scaled expectations back to, what would it be, fifth, you know, like the 5th grade level. And there's a lot of uncertainty around how to handle that. But along with that is a lot of tired and exhaustion and anxious, and the back and forth is more exhausting than anything because I don't think any of the school staff have time to regroup and refocus and reorientate. Okay, this is where we are and this is how we're moving forward. It's just, this is what I'm supposed to be doing. So yeah, there's definitely a gap there between what's being said and seen and known, and how do we work through that.
I'd love to just take a moment. We're lucky to have Taylor Bryan Turner here with us. She's our Assistant Regional Administrator for SAMHSA's Region 1 office, and she is the brainchild behind HEART. And so it would be great to hear Taylor from a national SAMHSA perspective, thinking about the importance of this and why we're all here together.
Yeah, thank you, Dana. Happy New Year, everybody. Hi, Martha, Ingrid, and Sarah. Hi, HEART members. It's just a pleasure to see you and honor you. I just wanted to thank you all for continuing this incredible work. As you know, at SAMHSA, we are devastated about the numbers that we're seeing these days in our youth, in our schools. Mental health is a priority and a grave concern. Overdose prevention is our #1 priority at SAMHSA. We want to make sure that our youth are as healthy and strong as possible. They have endured far too much. We have over 800,000 people who have lost their lives to COVID, and that means that there's 800,000 family members that are suffering, and that means that our children are suffering as well. So the mission of HEART is just kind of a no-brainer, right? Because of the access to transportation, the Medicaid, the cost of healthcare, the barriers, the cultural different components that we have to face. There's religion aspects that we have to be delicate with. We have Afghan and asylum seekers, refugees coming here, trying to integrate into our systems. How do we do that compassionately? We need to be able to do that with you. And so we know that our youth are using drugs and alcohol, tobacco, they're vaping, they're finding outlets to deal with their stresses, and they're not always talking about these things at home. And once they go home, sometimes they don't use that time to communicate their feelings to their family members. And then they only have their circle at school, right? So you all are the unsung heroes, the ones that are kind of watching, but can also wrap your arms around the students that need the support that you're giving. And so there's a lot of collaboration at SAMHSA right now with the Administration for Children and Families to really make sure that we're getting to the youth that need us the most and make sure that there's access. And I can't say access enough. I think that's really what brought us all together, is making sure that students and their families felt empowered and that they had access to be able to get the support that they need. So I'm just overjoyed about all of the compassionate conversations that are happening, all of the learning tools that we work so hard to put together, because you really feel like the work that you're doing is making a difference. And we know that our workforce is hurting. And I think I heard a little bit of that. There is burnout is a really, really real thing. And as youth are watching you lead them, hopefully they feel inspired to continue the work that you are doing for them, to expose them to this work, and that they choose to go to school and continue their education so that they can sit in your, or walk in your shoes, if you will. So we're working on it, and we hear you loud and clear. So thank you very much for giving me this opportunity to speak to you and to listen, most importantly today. Thank you.
Thank you so much, Taylor, for that context. We do need to reserve just a few minutes at the end to wrap up with our upcoming events and next steps, but we have about 5 more minutes for questions. If you have any questions for Tracy, Taylor, our New England school mental health team, any broad questions about collaborating on school mental health, now is the time to ask them or weigh in with a challenge or success.
I can share a success. So this school year, each of our classrooms has a reset or a cool down area. And in these in the areas, there's several tools, there's fidgets, there's guided imagery, there's coloring, there's different, based on the grade level, there's different things in each of the reset areas that kids could use to help regulate themselves. One of the other things we're adding to the reset area is school-wide taking 3 collective breaths every morning. It's one of the strategies that we're using through the Character Strong. So in the morning, on the days that I'm there, because I'm the dean at 2 elementary schools. So on the days that I'm there in the morning as part of morning announcements, I will be walking through taking 3 collective breaths as a school. So it's a school-wide thing, and we'll start every morning. And then that's one of our goals for the month of January and February that we will, be playing up and talking about in the classroom and encouraging kids to use and practice taking 3 collective breaths. And then when situations arise, when we're talking about the mood meter and different feelings on the mood meter, we'll be connecting those to the 3 collective breaths to move them in more positive areas of the mood meter. So that's one thing. All of our teachers have their reset cool down. Some of them have different names, but everyone has them. And I'm in pre-K 5. We have 459 kids. And then in the morning doing the collective breaths as part of morning announcements, and just everyone encouraging the kids and even teachers modeling it in the classroom.
Thank you so much, Tanya. That's a great practice. And Miriam asked a wonderful question in the chat about any specific models around school mental health. She mentioned the National School Mental Health Curriculum and the Integrated Systems Framework. Does anyone have a specific model that's been working for them? It's not necessarily a mental health model, but we've been learning more about the community schools framework, which is more about prevention of those types of mental health challenges. And we'll have a panel on that soon. But we have heard a little bit of feedback from folks in our networks who have used both of the systems that you mentioned. But I don't know if anyone on the call wants to go into a little more depth in the last couple minutes. We'll come back, Miriam, and come to more sessions, and I'm sure we'll have some discussions about various frameworks and models. Definitely towards the end of this series, we'll have a session that's just about comprehensive school mental health, and hopefully folks will share some different frameworks and models that are working for them. But we are getting towards the end of the hour, so I am going to go ahead and pass it over to Martha to close us off, telling you a little bit about some of the resources that we have and our upcoming events.
Thank you so much, Dana, and thank you, Tracy, and all of you for being here this afternoon. We hope that you will check out some of our resources and join us for upcoming events. If you visit our national website at the MHTTC network, you can find ways to link to ClassroomWise for comprehensive school mental health curricula for school staff, and for more information about the National Best Practices Framework model. Next.
Sorry, it went to the website for ClassroomWise. So
You're
there
seeing
you are.
telling us how you can go. All of these are linked in the slides when you get them, as Dana just demonstrated. We also have a virtual training library that's available for you and organized by topic and speaker and different types of resources on a variety of topics, from neurobiology of trauma and stress to trauma responsive practices in schools, comprehensive, compassionate school mental health, and other things. So check out our virtual library if you're looking for specific video resources. And we also have our resource directory that has a variety of tip sheets, toolkits, videos, and links to additional resources on particular topics. Again, all of this is linked. And we hope that you will join us for some of our upcoming events. Our next event is February 10th. It is our Cultivating Compassionate School Communities Community of Practice. And then January 27th, oh, actually, those should be reversed chronologically, sorry about that, is our Connecting with Disengaged Youth listening session with Sean Perry that Dana mentioned, which I think is going to be really terrific. So that's January 27th. And then our next session for this Heart Collective series is on February 3rd at 4 p.m. So we hope that you will join us for that to discuss funding and logistics for collaborative comprehensive school mental health systems. So that's a pretty juicy topic to cover. So please join us for that. And you can register through the link that Ingrid just dropped in the chat or through the links in the slides. Thank you again for joining today's webinar. As we mentioned, our funding comes from SAMHSA, which requires us to evaluate our services. Our technical support manager, Ingrid, has just, or will just put a link to the very brief evaluation survey that SAMHSA asks us to have our participants complete. You can also use your phone to scan the QR code on the screen that you see there, or click it in the slides when you get them, or there it is in the chat. So attendees providing their email addresses will also receive this survey 24 hours after the close of this event, along with the slide presentation. We appreciate your honest, anonymous feedback, which will provide information to SAMHSA and assist us in planning future meetings and programs. Your feedback counts, so please do fill that out for us. For more information about the MHTTC and our work, please go to our website or send us an email at newengland@mhttcnetwork.org, or feel free to contact either myself or Dana. Our email addresses are in the slides, and please stay posted to our website for more information about upcoming events. And remember to subscribe to our newsletter to learn more about resources to support mental health in schools. So we just want to thank you so much for being here with us this afternoon. And we hope to see you at our next event. Take care of yourselves. Stay healthy.
Thank you so much, everyone.